हेलो।
यस सर।
हाँ जी सर।
यू आर लाइव
आप
नाउ।
यस सर, आप मुझे लिंक भेज दें एक बार।
यस सर।
पानी दे दो थोड़ा सा।
भेज रहा हूँ।
ठीक है सर। Hello everyone. I hope yes, my voice is audible to everyone. Please put a message in the comment section if my voice is audible. Thank you. Hi Athira. Hi Sasi. Hi Diksha. Richa, Manish, Mohan, Pooja, Afreen, Shivani, Vineet, and Muskan. So many students we have. Hello Priya. Hello Athira. Hello Raj. We're going to start the session in 30 seconds. It's 8:59. We're going to start the session at 9 o'clock. Today's topic of choice is atrial septal defect, one of the very important topics of cardiology. And we're going to talk about important discussion of this topic. And hello, Pooja. Hello, Afreen. So it's 9 o'clock. We're going to start the session in 10 seconds. I just have to, get everyone on this platform. Okay, still we have 20 seconds left. Don't worry, we're gonna start it. This is a very important session. Please, for God's sake, put your best intention in this session. This session will be exactly for 30 minutes, and we're gonna talk about important
Good evening, ma'am.
pointers regarding atrial septal defect. We're gonna start the session soon. Just 10 more seconds. We're gonna start the session.
मैम आपकी आवाज नहीं आ रही है, बहुत डिस्टरबेंस आ रहा है। आई एम कॉलिंग यू।
We're going to start the session very soon. This is a very important session. Please have your copy and pencil ready with you. The topic of choice is atrial septal defect. And we're going to talk about the clinical features, hemodynamic investigations and management. How do we do in a case of atrial septal defect? And also we're going to cover the theory as well as clinical questions pertaining to this topic. Very wonderful questions have come from this topic. Around 10 to 12 MCQs are there for this topic. So if you listen to me for the next 30 minutes, then your 10 to 12 MCQs will be happily solved. But you have to pay attention for this class because it's like maths. Hemodynamic of cardiology is like maths. 2 plus 2 has to be 4. So you have to pay attention for that. Okay. Perfect. Okay, let's start the session. Yes. So hello everyone, welcome to Pediatrics by Dr. Anand. Today's topic of choice is atrial septal defect. Atrial septal defect. And of course, before touching that topic, we always have this, always a wonderful motivating quote.
सही से टेलीकास्ट हो रहा है क्या?
Today's quote we have is, the quote for today evening is, in the end, we only regret the chances we did not take. In the end, we only regret the chances we did not take. So you, even though you're prepared or not prepared, you have to take that chance. You have to have that positive thing in your mind that I will clear it, I will do it. We always have this question, will I be able to do it? नहीं, मेरा सिलेबस कवर नहीं हुआ, आई थिंक मैं नेक्स्ट टाइम दे दूंगा, इस बार तो चलो ऐसे एग्जाम दे देते हैं, दे जो होगा देखा जाएगा, मैंने पढ़ाई नहीं कर रखी, मुझे टाइम नहीं मिला. There are so many doubts and regrets and dilemma we have. So lekin you have to give your best shot. You have to try to give your best shot. Okay, because in the end we only regret the chances we did not take. So सारे के सारे एग्जाम्स तो जो होगा देखा जाएगा, ज्यादा नहीं सोचना, अपना बेस्ट करने की कोशिश करिए और एग्जाम दीजिए. बस कूद जाओ कुएं में, या तो इस पार या तो उस पार, ऐसे करके हमें स्टार्ट करना है और आराम से हो जाएगा. Today's topic of choice is atrial septal defect. एट्रियल सेप्टल डिफेक्ट। अब यहाँ पे जो है हमारा पे एक बहुत, दिस इज अ लाइव क्लास एंड इट्स अ डिस्कशन क्लास, ओके, यू हैव टू डिस्कस विद मी, देन ओनली यू विल बी कनेक्टेड विद मी। सो टुडेस टॉपिक ऑफ चॉइस इज एट्रियल सेप्टल डिफेक्ट, एट्रियल septal defect. So we have this right atrium and we have the left atrium. So there is a defect, there is a defect in between these two atrium known as atrial septal defect, right? So question number one of right now I would like to ask everyone, tell me one thing, this atrial septal defect, is it a right to left shunt or is it a left to right shunt? That is the first question which anyone should ask to you in the class. So what do you think, this atrial septal defect, is it a right to left shunt and left to right shunt? Yes, very good. Students who are answering this wonderful question is Sneha, Chanchal, Manish, Athira, Kajal, Jyoti, and again Akhira. Okay, so now listen to me very carefully. Okay, this class, 30 minutes, just listen to me like a movie and try to answer. Point number one, atrial septal defect, it is a left to right shunt. That is the first answer. Why, sir? Why left? What do you mean by left to right? Means if I open this channel, if I open this gate, people will only and only jump from left to right. Okay, why? Because the left side of the heart, because the left side of the heart has a higher pressure system as compared to the right side of the heart. That is why this atrial septal defect, it is a left to right shunt. Are you understanding? So I'll repeat again, the left side of the heart has a higher pressure as compared to the right side of the heart. That is why atrial septal defect is a left to right shunt. Point number one, this is the first question and first answer. Second question we have, tell me one thing, this left to right shunt atrial septal defect, is it a cyanotic congenital heart disease or acyanotic congenital heart disease? That is the second question which you guys should tell me. So what do you think? I'll give you 10 seconds. See, everything is a key, okay? Dheere, dheere, slowly, we're gonna reach the topic. Okay, one by one we'll go. So is it a cyanotic congenital heart disease or acyanotic? Will the baby be cyanosed in this condition or acyanosed, and why? The students are answering this question are Nidhi, Aradhana, Muskan, Syantika, Jyoti, Vandana, Afreen, and many other. We have more than 100 students who are right now and have come to this class in a very short notice. I don't know so many. How come everyone came? Okay, good. So always remember that in the atrial septal defect, all the left to right shunts, all the left to right shunts are acyanotic congenital heart disease. All the left to right shunts are acyanotic congenital heart disease. Why? Because in general, the blood, if it is going from left atrium to the right atrium, then right atrium to the right ventricle, then right ventricle to the pulmonary artery, and from pulmonary artery, where it is going? It is going to the lungs. Why lungs? For the purification. It's a normal process, right? So in any congenital heart disease where the blood is going to the lungs for the purification, that congenital heart disease will be a acyanotic congenital heart disease. Whenever there is a lung channel, whenever there is a pathway of lungs where the blood is getting reaching to the lungs, then this will be a acyanotic congenital heart disease. Did you understand in this 5 minutes? Two questions we have covered. That number one, atrial septal defect, it is a left to right shunt, and number two, we have covered it is a one of the acyanotic congenital heart disease. Acyanotic congenital heart disease. Did you understand this much? I hope you have understood. Question number three. So atrial septal defect. Question number three I have here is this atrial septal defect, which is a left to right shunt. Will it cause plethoric lung fields or will it cause oligemic lung fields? This is my third question. My question is this atrial septal defect, which is a left to right shunt or acyanotic congenital heart, will it causes plethoric lung fields or will it cause oligemic lung fields? What do you think is the answer for this question? First, you try to answer, and then I will tell you the right answer. The students who are participating this question are, of course, we have Raki, we have Oshi, Ashin, we have Elsie, Vandana, Sumit, Pooja, Mansi, Santika, Ashika, Amir, Himanshu, Lipika, and Patidar Abhishek. Okay, yes, very good. Beautifully, people are answering, means you are getting the concept. Please remember the meaning of plethoric lung fields is increase pulmonary blood flow. For the newcomers who have come new for this class, the meaning of the plethoric lung fields is nothing but increase pulmonary blood flow, and the meaning of oligemic lung fields is decrease pulmonary blood flow. Decrease pulmonary blood flow. Okay, so in this condition, of course, we can see that normally also from the superior vena cava, the blood is entering from the right atrium, then to the right ventricle, then to the pulmonary artery. Whereas in ASD also, the blood is coming from left atrium to right ventricle, means too much of blood is entering into the pulmonary artery. That is why the answer for this question will be that atrial septal defect is one of the congenital acyanotic heart disease with plethoric lung fields. Plethoric means increase pulmonary blood flow. When too much of blood flow is going to the pulmonary artery, that is known as plethoric lung fields. So now we have covered three wonderful important points. That atrial septal defect, it is a left to right shunt, it is acyanotic congenital heart disease, and it is one of the congenital heart disease with plethoric lung fields. If this much you have understood, please put a message in the comment section. Okay, wonderful. Let's move further. So the atrial septal defect is divided into development and types, hemodynamics, clinically how the patient will look, what are the chambers enlarged, X-ray finding, ECG finding, and treatment. It is divided into this topic. Now, first coming to the atrial septal defect development, how this atria septa is, development is there. So for the development of this atrium septum, this development, so how to start with it? I'll show you one picture. This one. Okay, this is a very random picture which of the development of atrial septum, this septum. So the septum starts with this. There is one component which comes here. There is one component which comes here, and this component is known as septum primum. Septum primum. There is a component in the atrial septum development. There is a component known as septum primum, and this is nothing but known as endocardial cushion. This is known as endocardial cushion, and there is a gap here. Now this gap, very importantly, it is known as ostium primum. It is known as ostium primum. Okay, so there was a development of septum primum. It goes till down but not fully. Niche there is a gap known as ostium primum near the endocardial cushion. This is the first thing which happens. Okay, this is the first thing which happens. Now what happens? Now later what happens? Okay, this much I hope you have understood. Now later what happened? This ostium primum closes, and this thing becomes full attached to the endocardial cushion. The septum primum becomes fully developed till down, and it touches the endocardial cushion, and at the same time there is a gap. There is a gap over here. I'll show you one picture. This one, can you see that this thing septum primum was full going down and touching the endocardial cushion, but now there is a gap. Now there is a gap in this septum, and this is known as ostium secundum. This is known as ostium secundum. Very important is the development of the atrial septum. I'll repeat again. In the beginning, we had something known as septum primum, which was nicely going down, and there was a gap known as ostium primum. Later, what happens? This septum primum fully touches the endocardial cushion, and there is a defect, automatic defects which comes above, and that defect is known as ostium secundum. Okay, so now you know septum primum, ostium secundum. Three things, three words I assume that you are able to understand in your head. Okay, after this gap of the ostium secundum, there is one more line. There is one more line which goes down, 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 and something like that. Okay, there is one more line, one more channel which goes down like this, and still there is a gap. Let me show you a proper picture. This one. See this very carefully. This line I was talking about, this septum, which goes down, 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 but still there is a gap. So this is known as septum secundum. This line, this thing which I'm making is now is septum secundum, and the gap which I left it out, that is known as foramen ovale. That is known as foramen ovale. Okay, are you understanding? This is very important. See, okay, so I'll see, मतलब ऑस्टियम सेकंडम अलग चीज होती है, सेप्टम सेकंडम अलग चीज होती है, ठीक है. सो सेप्टम सेकंडम गोज फुल, एंड below in between there is a gap known as foramen ovale. Now this is the normal anatomy or normal development of the septum, of the atrial septum. It is a 3 marks question for theory exams, and they can clearly ask you this much. Okay, so this is one segment. Now coming to the next part, there are various types of atrial septal defect. There are four types. There are four types of atrial septal defect. One is ostium primum, number one. Number two is ostium secundum. Number three is sinus venosus. And number four is coronary sinus. At least for this theory topic, you need to know the names. There are four various types of atrial septal defect. So we have ostium primum, ostium secundum, sinus venosus, and coronary sinus. Okay. Okay, I hope you are able to get what I'm trying to say. Okay, so and one, now there are two exam questions over here. The most commonest type of atrial septal defect among these four is the ostium secundum. Ostium secundum type of atrial septal defect is the most commonest type of atrial septal defect. That's an exam question, that's a theory question, that's a clinical question. Okay, now please remember, in a case of Down syndrome, the most common congenital heart disease in Down syndrome is atrial septal defect, and most specific will be ostium primum type of atrial septal defect. Now we have to pay attention here. Now we are talking something little big, okay, right now. In Down syndrome, the most common congenital heart disease is ostium primum type of the most common congenital heart is atrial septal defect, or you can say ostium primum type of atrial septal defect. But if I talk about atrial septal defect topic per se, the most commonest type of atrial septal defect is ostium secundum type of atrial septal defect. These two things are important. और atrial septal defect question आएगा तो उसमें most commonest type is ostium secundum. अगर डाउन सिंड्रोम क्वेश्चन आएगा तो उसमें मोस्ट कॉमनेस्ट यूजुअली ऑस्टियम प्राइमम टाइप ऑफ एट्रियल सेप्टल डिफेक्ट नजर आता है. ये बहुत इंपॉर्टेंट पॉइंट है जो मैंने आपको बता दिया है. ठीक है, नेक्स्ट. Okay, yes. अब आ जाओ the middle part. Now, in a case of atrial septal defect, there is the now atrial septal defect is there, which is a left to right shunt. Now, अभी audience की बारी आती है. Let's see how's everyone gonna answer it. The question for today is, what will happen to the T1 in a case of atrial septal defect? The options are T1 will be soft, or T1 will be loud. So put your answers in the comment section. Let's see if you can answer. You know, right? What is T1? This is T1, tricuspid wall. This is M1, mitral wall. Okay, this is P2, pulmonary wall. And this is A2. This is aortic wall. You know, right? We have S1 and S2, the first heart sound and second heart sound. S1 is usually the first heart sounds is because of the closure of these two walls, which are T1 and M1. Whereas the second heart sound is because of the closure of this semilunar walls, which is P2, pulmonary and aortic wall. Okay, do you know this much basic? Are you able to get understand what I'm trying to say? S1 S2 होता है first heart sound, second heart sound. First heart sound is because of closure of the this tricuspid and mitral valves, whereas second heart sound is because of the closure of the pulmonary and aortic valves. ठीक है, समझ में आ गया? अब सवाल ये आता है कि एट्रियल सेप्टल डिफेक्ट में T1 क्या होगा, बहुत लाउड होगा या बहुत सॉफ्ट होगा? द स्टूडेंट्स आर आंसरिंग दिस क्वेश्चन. लेट्स सी इफ एनीवन कैन गेट अ राइट गेस. We have Manvi, Nikshay, Nidhi, Narayan Singh, Raki, Afreen, Manvi, Savi, Devika, Vritika, and Sanjana, Sanesh, Richa, Pallavi, and Danish, and Ashika, and Raki. बहुत सारे हैं, ठीक है. Okay, so answer, the best answer for this question. See, you have to understand what I'm trying to tell you. No cramming, no rattafying. Understand. Okay, the concept. The question is, what happens to T1 in a case of atrial septal defect? So होता क्या है, मतलब हम सब जानते हैं, right? The blood is normally coming from superior vena cava to the right atrium, and also blood is coming from the left atrium to the right atrium and to the right ventricle. So too much of blood, can we see too much of blood? Too much of blood entering into the tricuspid wall, yes or no? Do you agree with me? There is too much of blood, right, entering in the tricuspid wall. One from the superior vena cava to right atrium to right ventricle, and one from the left atrium to right ventricle. तो इतने सारे ज्यादा होगा blood, तो there will be loud T1. There will be loud T1. Okay, are you understanding? Put an answer in the comment section, yes or no. So there will be loud T1. इतना सारा blood अगर जाएगा, so much of blood, if it is pushing through a wall, then of course it will be a T1 will be very loud. It will not be soft. Okay, for keeping it soft, you have to push less blood. Okay, very good, perfect. So loud T1, okay. So now we have covered much important topics. Now you know the basic introduction of atrial septal defect. You know the various types of atrial septal defect: ostium primum, secundum, coronary type, sinus, all the sinus venosus types. Most commonest is ostium secundum, but in Down syndrome, the most commonest is ostium primum. Okay, these all are exam questions. Perfect. Next question. So these all parts, yeah. Okay, now listen to me very carefully. Now this is one good segment. Now there are a lot of shunt murmurs and flow murmurs. Okay, now in atrial septal defect, one thing you need to know, something known as एग्जाम में आता है कि प्राइमरी मर्मर कौन सा होता है ASD में, और सेकेंडरी मर्मर कौन सा होता है. Means which is the main murmur, which is the secondary murmur. Please remember, the primary murmur is at the pulmonary area, and the murmur is ejection systolic murmur. Okay, I'll tell you the explanation also. The first, you need to understand primary murmur. Hello Madhu, hello, good evening, hello. So the primary, now listen very carefully, last 10 minutes left and this topic is over. Okay, the primary murmur in atrial septal defect, this atrial septal defect is nothing, is at the pulmonary area, and which murmur? The murmur is ejection systolic murmur. So sir, why sir, how, what, मतलब कैसे, how do I remember कि भाई the primary murmur is at the pulmonary area and the murmur is is ejection systolic murmur? So the answer is, as you know, that there is blood coming from the superior vena cava and inferior vena cava, right? Superior vena cava and inferior vena cava, the blood is normally coming to the right atrium. Plus, there is extra blood also from the left atrium to the right atrium and then to the pulmonary, to the right ventricle. Means one, are you understanding? Too much of blood is coming. No, one from the superior vena cava to right atrium to right ventricle, and one from the left atrium to right ventricle. When too much of blood is attacking, when too much of blood is entering at the pulmonary area level, what will happen? That will lead to right ventricular hypertrophy. Yes or no? होएगा नहीं होएगा? Do you agree with me? Will too much of blood entering into the right ventricle will lead to right ventricle hypertrophy? That's a very important basic thing, right? Too much of blood entering, so the वो valve hypertrophied हो जाएगा, size बड़ा हो जाएगा उसका. So too much of blood entering will lead to right ventricular hypertrophy, and that is the reason you see a left parasternal heave in atrial septal defect. एट्रियल सेप्टल डिफेक्ट में जो क्लिनिकल एग्जामिनेशन दौरान आपको लेफ्ट 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 पैरास्टर्नल हीव मिलता है, लाइक काइंड ऑफ अ लिटिल लिटिल प्रोजेक्शन एट द लेफ्ट पैरास्टर्नल एरिया. Why only left parasternal area? Because देखो, over here, which what is involved? Pulmonary artery is involved, right? And when pulmonary artery is involved, so how do you check for heart borders? Pulmonary artery या pulmonary area कौन से उसमें आता है? Which border of the heart it comes? So you know that, right? We have the right second intercostal space, we have the aortic area, and left second intercostal space we have the pulmonary area. There are four areas, right? Aortic area, pulmonary area, tricuspid area, and mitral area. So the pulmonary area, where is the pulmonary area? It is normally at the left second intercostal space. So when there will be pulmonary artery hypertension, or when there will be too much blood going into the pulmonary artery, so that only area of the or the border of the heart will be affected, right? So of course you will have a left second intercostal space, which is the pulmonary area. So what will you hear? You will have a left parasternal heave. It's a very important exam question. You see a left parasternal heave in atrial septal defect. Why? Because left parasternal heave का मतलब left parasternal area का मतलब pulmonary area, and pulmonary area is affected. Why it is affected? अरे भाई, too much of blood is going into the right atrium to right ventricle, and also left atrium to right ventricle leads to right ventricular hypertrophy, and pulmonary artery is affected. That's why you see a left parasternal heave in atrial septal defect. And at the same time, the murmur which you see, the primary murmur at that pulmonary area, will be a ejection systolic murmur. Same over the left sternal border, same over the left sternal border, same over the kind of over the pulmonary area. Heave matlab there is a you can see the little projection जब overflow blood होता है, जब एक बाउंडिंग पल्सेस, एक बाउंडिंग चीजें चल रही होती है, तो आप एक पेंसिल भी रखोगे या आप एक क्लिनिकल एग्जामिनेशन भी करोगे, तो आपको एक अपलिफ्ट, एक पुश, एक बाउंडिंग जैसा वो होगा. दैट इज काइंड ऑफ अ पैरास्टर्नल हीव. एक उठाव महसूस होगा, एक एक्स्ट्रा पुश महसूस होगा, एक कंजेशन महसूस होगी. सो दैट इज पैरास्टर्नल हीव काइंड ऑफ अ थिंग. सो द प्राइमरी, so what are we understanding? The primary murmur of atrial septal defect is at the which area? Pulmonary area. Pulmonary area corresponds to which heart border? Left second intercostal space, or I can say left parasternal area or border, and I will see a parasternal heave in clinical examination. Okay, number one. Number two, the secondary murmur. The secondary murmur is at the tricuspid level. Now, ये बहुत important है. Please, if this much you pay attention, then your topic is over. The primary murmur was at the pulmonary area level, and the secondary murmur is at the tricuspid level, and there is a delayed diastolic murmur. Okay, Bharti is asking, can we see the heave through eyes? Yes dear, you can see parasternal heaves का grading होता है, वो बहुत आगे की level है. If you put a pen, if you put a hand, or if you just put visibly into the naked eyes, there's a grading of parasternal heave, but it is one of the clinical examination only which you see, and which you confirm it later, so you can see. Okay, yeah. So secondary murmur in the case of atrial septal defect is at the level of tricuspid wall, and tricuspid wall पे क्या दिख रहा है? Delayed diastolic murmur. Why there is delayed diastolic murmur? Now listen very carefully. Secondary murmur will be the delayed diastolic murmur of the tricuspid wall. The question is why. Now listen very carefully. Okay, number one, as you know that there is normal physiological split during inspiration. I'll repeat carefully. There is a normal physiological split. Which split are we talking about? We're talking about A2 and P2. जो हमारा second heart sound होता है, the S2 is because of the closure of the pulmonary wall and the aortic wall. Yes or no? है ना? I told you that. Normally what happens, you should know that A2 closes early than P2. Normally A2 closes early than the P2, even though second heart sound is because of the together closure of the aortic and pulmonary valves. But if we talk about microseconds or microfractions, A2 closes early than P2 normally. Why? Because in general, no, you take full inspiration. So a lot of blood is coming from superior vena cava, inferior vena cava, entering the right atrium, right ventricle, and then the pulmonary artery. So right side of the heart has to do a lot of work. Okay. So P2 closes little late than the A2. This is normal. Normally, this is happens. Okay. So that's what. So that's this line is. Please read with me. There is a normal physiological split during inspiration. It is normal. This P2 A2 split is normal, which I'm writing here. Now, so normally right atrium and right ventricle takes more time to empty the empty on taking a deep breath inspiration. Are you understanding? So the basic line is during inspiration, right atrium and right ventricle takes more time to empty. That is why P2 closes little late than the A2. This is normal. Now, what happens in atrial septal defect? In atrial septal defect, already too much of blood is going from the left side to the right side and then right atrium to right ventricle. So now what will happen? Now the P2 closes more late than the A2. Yes or no? Normally I was saying कि भाई P2 closes late than A2 normally, but now of course in atrial septal defect, because of the left to right shunt, because so much of blood is pushing from the left atrium to the right atrium to the right ventricle. So in atrial septal defect, this process of delayed emptying is more delayed. Yes or no? The process has been more delayed. That's why you see a delayed diastolic murmur in a case of in tricuspid wall, in a case of atrial septal defect. These two are very important points. So I'll repeat: the primary murmur is at the pulmonary area, the secondary murmur is at the tricuspid area. In tricuspid area, you see a delayed diastolic murmur. There is delay in the diastole. Why? Because so much of blood has already gone from the left head to the left to the right side, and that's why delayed diastole. Diastole is delayed over here. Okay, done. Yes. Now this was about the murmur. Last few important points. The shunt murmur. The shunt murmur is absent in a case of atrial septal defect. Now this is one extra line you need to understand. One is flow murmur. One is shunt murmur. Too much of detail I can't tell you in this one webinar. You just have to basically understand there is something known as flow murmur, something known as shunt murmur. Shunt murmur is absent in a case of atrial septal defect, because for doing a shunt, why it is absent you need to understand, because murmur happens when there is turbulence. Okay, this shunt murmur or murmur will happen when there is turbulence. This is the atrial septal defect, right? This is a left to right shunt. So murmur will happen when there is a turbulence. When there is no turbulence means no murmur. So why shunt murmur is absent? Because there is a very small pressure gradient between the right atrium and the left atrium. So this left atrium and the right atrium, the shunt which is left to right, which is there, but still the pressure which I'm talking about, no, there is a very small pressure gradient. There is a very small pressure gradient between right atrium and the left atrium. That is why you don't see a shunt murmur in a case of atrial septal defect. You're right. So very good, wonderful. We have students who are answering. Ashika is answering. Ravina, Savi, Bharti, Syantika Datta. Very good. Okay. So if this much you understand, you have done PhD in ASD. Okay. That's it. Okay. So shunt murmur you don't see because a very small pressure, even though people will go from left to right, but the pressure gradient is very small to say it, kind of a shunt murmur. That's why. Okay. That you should know. So this part is over. Yeah. Now, last thing which you need to understand, last thing, primary murmur, I told you. Secondary murmur, I told you. Loud T1, I told you. Okay, everything is over. Last thing, which is a very simple, easy thing. Last thing is S2. S2 sound, you will see a wide fixed split of S2. Very simple, easy explanation. in S2 sound. What is S2? S2 is the second heart sound caused by what? By the closure of aortic wall and pulmonary walls. Yes or no? So what I'm saying is S2, the S2 sound in atrial septal defect, it's wide fixed split of S2. Why there is wide and fixed split of S2? Same reason I told you, right? See, in S2 there are two components, aortic component and pulmonary component. Normally what happens, A2 closes early than P2. A2 closes early than P2. Why? Because of the inspiration, a lot of blood has to come from superior vena cava to the right atrium to the right ventricle. So P2 closes little late and A2 closes early than P2. And of course, now what happens, now the A2 is more early closing. In a case of what you call atrial septal defect, too much of blood is going into the left atrium, then right atrium, then right ventricle. So now the A2 is more early closing. Do you agree with me? Yes or no? Put an answer in the comment section. Naturally, because now of the ASD, the A2 is more early closing than P2, right? Therefore, we say wide fixed split of S2. In theory exam, please write there is a wide fixed split of the S2, okay, in atrial septal defect. ये शब्द आपको याद रखना है. In atrial septal defect, in S1, the tricuspid component is very loud. In S2, you will see a wide fixed split. This is what you see. If this much you understand, it's perfect. Okay, done. So now who will tell me? Now let's come, 5 more minutes left, then the topic is over. Very good. I'm happy the students who are participating and answering. Very good. Narendra, Shivani, Afrin, Savi, Ashika. Very good. Very good, Nikita. So now tell me the last few slides and the topic is over. What are the chambers enlarged? Now you only will tell me. If there is a case of atrial septal defect, what all chambers will be enlarged? What do you think? Will right atrium be enlarged, or right ventricle, or pulmonary artery? What will enlarge? क्या बढ़ेगा, क्या नहीं बढ़ेगा? लेफ्ट वेंट्रिकल बढ़ेगा एट्रियल सेप्टल डिफेक्ट में? क्या लगता है आपको लोगों को? सो पुट आंसर इन द कमेंट सेक्शन. व्हिच चैम्बर्स आर एनलार्ज्ड इन अ केस ऑफ एट्रियल सेप्टल डिफेक्ट? प्लीज टेल मी. Yes, very good. So once there is a atrial septal defect, little bit right atrium will also enlarge, right ventricle will also enlarge, pulmonary artery also will enlarge. These three things will definitely enlarge. Left ventricle will not enlarge, of course. Very important. Left atrium also will not enlarge. This is a very important point. In a case of differentiating atrial septal defect from a ventricle septal defect, please remember, in an atrial septal defect, left atrium will not be enlarged. Why? Because blood यहाँ आते ही right side shift हो जाता है. The blood comes and right away it gets shift to the right atrium. It doesn't stay in the left atrium for so long. So that's why left atrium will not enlarge automatically. From the left atrium, suddenly the blood will go to the right atrium. Are you understanding? That's why right atrium enlargement, right ventricle enlargement, of course you will have a what you call a left atrium will not enlarge. Okay, that's why in X-ray also, of course, you will see right atrial hypertrophy, you will see right ventricle hypertrophy, you will see dilatation of the pulmonary artery, है ना? These three things you will see. Are you understanding? Now we're coming to the end of this session. Okay, so these three, yeah, only right side. Very good, Ashika is right. Right side की चीजें बढ़ेंगी. Left atrium enlarge नहीं होगा. ये बहुत important point है. Left atrium VSD में enlarge होता है. ठीक है. Left atrium does not get enlarged in the atrial septal defect. That's an exam question. Okay, this is the X-ray. It's a very wonderful X-ray picture. You can see. You will see right atrium hypertrophy. So this part we have the right atrium. We have right ventricle hypertrophy. This part we have the right ventricle, and pulmonary artery is dilated. So this kind of an X-ray in general, you will see a case of atrial septal defect. Atrial septal defect. Okay, that's it. This part is over. Yes, this part is done. And also see, one of my junior, like he had sent me a report. How does it come? Like, how does the reports come? See, this one of the patient, he has got a what you called a large ostium secundum. ASD measuring 24 millimeter with left to right shunt. So natural, see baat hai, it's a natural thing. So if this is the heart, it is a atrial septal defect. It is a left to right shunt naturally, and it's the ostium secundum. I told you the most commonest type of ASD is ostium secundum type of ASD. It's most commonest. So this patient is having large ostium secundum ASD measuring 24 millimeter. So measuring 24 millimeter, right? So now we'll do the surgical treatment. How do we, what should we do surgery for this case, or what should we do? So what do you think? Any idea? What we this ASD is 24 mm. So guys, what do you think? Do you want to do surgery for this case? You want to do conservative management? What do you want to do? Any idea? What do you think? Yes, very good. Students who are answering this topic are, of course, we have Ashika, Santika, Afreen, Atira, Mohan, Ashika, and yes, what's his name? Santika Datta. The answer for this treatment question is all the asymptomatic cases. If the patient is asymptomatic, treatment is not required. Okay. If the patient is asymptomatic, treatment is not required. Number one. Number two, now if the patient is symptomatic, the patient is showing you features, of plethoric lung fields, increase chances of increase incidence of upper respiratory tract infection, lower respiratory tract infection. So indication for surgery is all symptomatic cases or asymptomatic with a QPQS ratio of at least 2:1. Now, this is a very important exam question. QPQS ratio should be at least 2:1. What is this QPQS ratio? Pulmonary blood. Pulmonary blood is to systemic blood ratio. Pulmonary blood is to systemic blood ratio. If it is at least 2:1, then we'll think of surgery. Okay, very good. Yes, people who are right. Ravina is right. Anju, Jasleen, Ashika, Savi, Manvi, and Afroz. Very good. So if just remember this line for exam question, if QPQS ratio is 2:1, then definitely surgery is required. Symptomatic cases, surgery is required. And the timing, now this is another last exam question. The timing of elective closure of atrial septal defect is after the first year or before entering into school. In general, ASDs, we don't treat so early. We treat after the first year or before the entry into the school. This is again exam question. When do you operate for ASD? In general, we operate for before entering into school. ठीक है, done. That's it. That was all about atrial septal defect in general, incidents, clinical features, treatment, pathology. Thank you so much. Thank you so much for watching this video. This much theory is more than enough for you. Okay. And the last जाने से पहले हमारा एक प्यारा सा motivating quote: be answerable to yourself. Be answerable to yourself. No one is watching you study. No one is watching you attending my webinar. I am not what you called looking at you, and you are not looking at me. Be answerable to yourself. This is the time. It's do or die. So be answerable. Be answerable to yourself. However you are studying, study with good heart. Study with good intention. Okay, don't just study for the sake of studying. Study with real intention. Okay, no one is watching you study. Those days are gone. Those days are just gone. That your mom is watching, your dad is watching. Now no one is watching, only you is watching. You yourself is watching. So be careful, and God has been kind, and you also take care of yourself, and try to use the best time possible. Every single second is so important. Okay. Thank you so much for watching the webinar. My mobile number, you all know that my mobile number is 9999897081. For the newcomers, you can join my WhatsApp group, my webinars, my YouTube, Telegram, so many channels we have. You can join them, put a message on this WhatsApp number. And thank you so much, and let me know if you like the class. And have a wonderful, wonderful, what do you call it, day, night ahead.